Hi, my name is Dr. Fred Williams. I'm a gynecologist in Paris, Texas. I've been here for 25 years. And today I wanted to go over some of the pre-treatment and post-treatment recommendations for the MonaLisa Touch procedure that we do here in our office. The MonaLisa Touch is a gentle fractionated CO2 laser that we use to help restore vaginal health. It's treated for painful intercourse, for vaginal dryness, and for lichen sclerosis. Yes, are some of our pre-treatment recommendations that I'd like you to observe and will be helpful to you. First off, please take a shower or bath the day of your procedure. You don't have to bathe right beforehand, but have a bath that day. That will help. I would like you to trim any long pubic hairs that you have. You can either trim them or you can clip them with scissors. It doesn't have to be shaved, but I would like to have some of the longer hairs out of the way. It helps me visualize the outside of the vagina better and doesn't tend to get in the way. I'd like you to dress in loose-fitting clothing. Make sure you have pants and a top, because there's no reason to take your top off, and that'll be a little more comfortable for you during the procedure. For about 10 to 15 minutes before the procedure, either I or my nurse will apply some topical anesthetic. This topical anesthetic will take care of any of the pain that you will have during the procedure for the outside of the vagina. The internal part is essentially painless. And this has been working very well. Really get no reaction whenever I activate the laser on the outside vagina, even in the sensitive areas. So I've been very pleased with how this has helped with the discomfort or lack of discomfort for the procedure. I would like you to get some supplies and any post-treatment medications before you come to the office. I think that'll help. After the treatment, and especially if we do the outside treatment, there's potential to do the inside the vagina treatment and the outside of the vestibule. I'd like you to go to Walmart or CVS, and I'm not, promoting them, but get some Aquaphor. And Aquaphor is a kind of like Vaseline's treatment. And what I want you to do is to apply this to the outside of the vulvar area after your procedure until it heals. Now that's probably going to be 3 or 4 days. A little light coating of it keeps the inflammation down and makes it more comfortable for you. It also helps keep the urine off there, and the urine and the uric acid that's in it can sting the skin as you're voiding. You'll also need some mini pads to have those around. You also ought to plan on wearing just some loose cotton underwear so that it'll be more comfortable for you. Some people would like to have and will use some cold gel packs. A little cold gel pack you get at the pharmacy also. Or you can use a baggie with some crushed ice and wrap it in a wash rag. That's all that you need to do. About 20 minutes on, 20 minutes off. And I found that that'll help the first day. You probably won't need it after that. You should be able to go home directly from the procedure. You can drive yourself. You don't have to have anybody drive you. You can, if you have to go shopping or you have to go somewhere, you have to go out to dinner, there's no problem with that after the procedure either. Most patients are very comfortable and really aren't having any significant problems after we do the procedure. Things that on post-treatment that you need to know about: the skin's going to feel a little sensitive. We've done the procedure. It's there to create growth, to create restoring the vaginal health and the vulvar health. So you're going to feel some itching. You're going to feel a little tingling sensation. These are real common sensations that have been described. You may see a watery vaginal discharge, and that discharge is going to last 3 to 7 days as the little microdots heal up and as that seals over. And it's part of the reaction and part of the increased moisture that's coming back to kind of help restore the tissues. Continue to use a little bit of the Aquaphor and place that on there after you wash. It's okay to get in the shower It's okay to rinse things off. I would pat dry very carefully. I wouldn't necessarily rub the tissue, and apply some more of the Aquaphor and keep that occluded until it seals back over. No baths until it does, and that's usually on the order of 4 to 7 days. Also want you to refrain from any sexual activity if we treated the outside of the vagina for a week. If we've treated just the inside of the vagina, you can go back to intercourse in about 3 days. And those are the major points that we need to discuss for pre and post treatment for the MonaLisa Touch therapy procedure. I thank you for your time. If you have any questions, please don't hesitate to call us at our office, or you can visit me on our website at drfredwilliams.com. That's drfred williams.com. And again, I thank you for your time, and I hope to have you as a patient in the future. Thank you.